Hello, everyone. I'm Megan Hall, and I'm the athletic trainer for Wilson High School. In this video, I'm going to discuss the different types of sprains and strains, the differences between sprains and strains, the symptoms and treatments for both, and the best methods for prevention. I will be focusing on the ankle joint and the hamstring muscles. Let's start with some definitions. Ligaments attach bone to bone and are depicted as the large white bands in the picture. Tendons attach muscles to bones and are the smaller white bands. The muscle belly is the sum of all the muscle fibers in any given muscle, and a muscle fiber is a single muscle cell. Sprains are injuries to ligaments. They are graded from grade 1, which is a mild sprain with no significant structural injury, to a grade 3, which is a complete rupture of the ligaments. In the picture below, you can see in a grade 1 sprain, the ligament is still pretty much intact with some slight tearing. In a grade 2 sprain, the ligament has more significant tears but is still intact. And in a grade 3 sprain, the ligament has been completely torn. Ankle sprains are the most common injury in sports, with the lateral ankle sprain being the most common type of ankle sprain. They typically occur during inversion and plantar flexion and on an uneven surface. When this occurs, the lateral ankle ligaments become stretched and can tear. Ankle sprains have a high recurrence rate, so once an athlete sprains their ankle, they are more susceptible to spraining it again, because once the ligaments are stretched out and torn, they will never heal back to exactly how they were before. So there will always be some laxity in the joint. However, strengthening the muscles surrounding the ankle can help with stability. In this video, you can see the typical mechanism for injury of a lateral ankle sprain as the runner steps on the uneven surface. You can see your ankle go into inversion, placing stress on the lateral ligaments. Medial ankle sprains occur less frequently and have a longer recovery time than lateral ankle sprains. Recovery can generally take anywhere from several weeks to several months, depending on the severity. They're caused by an eversion injury, which is when the foot and ankle roll in the opposite direction than it would during a lateral ankle sprain. This causes an injury to the deltoid ligaments. This type of injury is usually not isolated and will typically be associated with a high ankle sprain or with a fracture. High ankle sprains are caused by excessive external rotation of the ankle that causes injury to the syndesmosis. Usually, this is by sudden movement of twisting or cutting. The syndesmosis are ligaments that are located above the ankle and between the tibia and fibula, which are the two bones in the lower leg. When you bear weight on your legs, the tibia and fibula experience forces that make them want to spread apart. The syndesmosis is a shock absorber that prevents the bones from spreading too far apart. High ankle sprains are common in high impact running sports such as football, basketball, and soccer. The recovery time is longer than that of a lateral ankle sprain. It can take anywhere from several weeks to several months for a full recovery. Some symptoms of sprains include pain, swelling, bruising, hearing or feeling a pop at the time of injury, and decreased range of motion at the joint. If you have an athlete with any of these symptoms, please contact your athletic trainer and they will do an evaluation and determine the best plan of care for your athlete. Treatment for sprains includes using the PRICE acronym: protect the joint from further injury, rest, ice, compression with an ACE wrap or compression sleeve, and elevation. Also, incorporating a rehab plan with your athletic trainer or physical therapist as necessary. To prevent ankle sprains, strengthening and balancing exercises can be used, such as single leg calf raises, single leg squats, or using resistance bands. You can incorporate ankle strengthening exercises into your dynamic warm up. Increasing the muscle strength will add stability to the ankle. And so when the ankle goes into plantar flexion and inversion, which is that position where lateral ankle sprains are likely to occur, The muscles that evert the ankle will be stronger, and the athlete will be able to correct and pull themselves out of that position where they're likely to be injured. Educate your athletes on why these exercises during warm up are important and why they should be taken seriously. Right, moving on to strains. A strain is an injury to the muscle belly. It's graded just like sprains, from grade 1 being a mild strain with little structural damage to a grade 3 with a complete rupture or tear of the muscle. You can see in the picture that the muscle is still intact in a grade 1 strain, and grade 2 strain, it's completely intact with more significant tears than the grade 1. And grade 3 strain, it has been completely ruptured or torn. When you have a more severe tear, there will typically be an obvious deformity, and the muscle may look like it's separated or balled up. Strains are when the muscle becomes overstretched and tears. This occurs due to fatigue, overuse, or compensation. When an athlete gets tired, they may change their form and start using muscles in a way that they wouldn't normally. This can also happen if an athlete has bad posture. Bad posture causes muscle imbalances where some muscles may be stretched out while others are tight, leading to an increased risk of muscle injury. Some of the most common muscle strains seen in sports are in the hamstrings and in the low back. The picture on this slide is of the hamstring muscles, which are on the back of your thigh. On the left side, the muscles are normal with no injury, and on the right side, they're examples of grade 1 through 3 strains next to each other so you can see the severity. Some symptoms of muscle strains include pain, redness or bruising, muscle spasms, swelling, weakness, and decreased range of motion. If you have an athlete presenting with any of these symptoms, please contact your athletic trainer and they can do an evaluation and determine the best plan of care for your athlete. Treatment for muscle strains is similar to sprains. Protect the muscle from further injury, rest, ice, compression, and elevation. A rehabilitation plan with your athletic trainer or physical therapist, along with modified activity during practices, can facilitate recovery after the injury. To help prevent muscle strains, incorporate a dynamic warm-up prior to a practice or competition. This warm-up will increase the temperature and blood flow in the muscles, decreasing the risk of injury. Over time, you can also gradually increase the training intensity. This will decrease the chances of muscle fatigue. Always ensure that your athletes are using the proper technique throughout the workout and game. Following exercise, athletes should cool down and static stretching can be done at that time. As always, stress the importance of having a good warm-up and cool down with your athletes. Educate them on how it can help them prevent injuries. So a quick recap: sprains are injuries to ligaments, strains are injuries to muscles. Both are given a grade based on their severity. For the prevention of injuries, use a dynamic warm-up, proper technique, and a good cool down following exercise. And most importantly, educate your athletes on why they're doing a particular warm-up exercise and why they need to cool down after a workout. The more informed they are, then the more likely they are to put in a full effort in these activities and take them seriously. These are the references I used. The NATA, or National Athletic Trainers Association, has some great information on sprains. They have a consensus statement on ankle sprains that has a lot of information on prevention and treatment. They also have some information on signs of hamstring injury and treatment options. If you have any questions or suspect one of your athletes has a sprain or strain injury, please reach out to your athletic trainer and they will recommend the best treatment option for your athlete. Thank you for watching this session. Please fill out the survey link found on the Bon Secours virtual training page. This will help us improve our videos and present topics that you might be interested in. Thank you.